followed Dr. Lee in clinic for the past few weeks, and oftentimes you mention this theorem of Occam's razor. Can you speak a little bit about how that applies to the medical field and specifically your practice?
So in my practice, I'm often confronted with patients who have very complex and long histories. And one of the things I like to do is make it as simple as possible, but no simpler. And by that I mean we'd like to get to a single unifying diagnosis if we can. And the problem with modern medicine is you are bombarded with too much information. The electronic medical record has too much information, and so it's very easy as a beginning learner in medicine to get distracted by all sorts of things that have nothing to do with the case. However, if we can simplify the problem list and try and get to a single unifying mechanism and ultimately a single unifying diagnosis, the simplest answer is usually the correct answer. And that is what we mean by Occam's razor. We are using the razor to shave away all the distractions and just leaving us with a single unifying diagnosis. For example, in a patient who has the following problems. A 35-year-old white female presents with a red eye, and then she gets a bulgy red eye, and then she gets double vision, and then she gets loss of vision. It's easy to get distracted by that long laundry list of complaints. However, the most common cause of acute unilateral or bilateral proptosis in adults is actually thyroid eye disease. And so if we can make the red eye horizontal muscle injection, if we can make the proptosis from extraocular muscle enlargement, if we can make the double vision from a motility deficit, and if we can make the loss of vision from an optic neuropathy, a compressive optic neuropathy, then we'll have a single unifying diagnosis that will explain all of this patient's symptoms and signs. So instead of just having a laundry list of symptoms or complaints or problems, red eye, bulgy eye, double vision, loss of vision, optic neuropathy, we would try and look at the case and make a single unifying diagnosis. And in that person's case, we try to make it in the orbit, causing compression, causing diplopia in a red eye, and that means linking the things together with the razor. And so Occam's razor would dictate that thyroid ophthalmopathy would be a better single unifying diagnosis for that constellation or sequence of problems. And we do the same thing with the HPI, and we do the same thing with the focused stem and the chief complaint. So if you haven't watched those videos, you should as well. So we need to go from a chief complaint to an HPI to a focused stem to a single unifying diagnosis or mechanism. And the razor means having a simple explanation is best and a single explanation. But some patients have multiple problems, and so that's Hiccum's dictum, which is the opposite of Occam's razor. A patient can have as many diseases as they pleases, but in general, we prefer the razor to Hiccum's dictum.